Well, good morning and welcome again to the Global Health Symposium hosted here in San Antonio by Texas BioMed. I am absolutely thrilled and honored to be able to represent our community and my organization in moderating this panel discussion specifically on the intersection of public health and the economy. My name, as Larry mentioned, is Jenna Saucedo-Hererra, and I'm the CEO of Greater SATX. We are the Regional Economic Development Collaborative here in San Antonio. But I am joined by 5 esteemed panelists, 2 with us here today, and 3 that are joining us virtually from around the world. If you're okay with it, what I was thinking is I would briefly introduce the panelists, provide some high-level remarks and a summary of how I believe the pandemic has impacted our San Antonio economy, and then we'll dive into questions. Does that sound okay? Wonderful. Okay, I see some head nods. All right, what I will tell you is you should definitely check out the program to read these extensive bios, because these panelists that I have here virtually with us and here on stage are very impressive. In fact, their titles alone are longer than my comprehensive resume. But here joining me on stage are Christopher Boone, Vice President of Global Head of Health Economics and Outcomes Research with AbbVie. Welcome.
Thank you.
And thank you for being here in San Antonio.
Yeah, can you hear me?
We can. And then, of course, our very own Heather Hanson, who's the CEO of BioMed San Antonio. Welcome, Heather. And then joining us virtually here, hello, everyone. Good to see you.
Hello.
Joining us virtually are Phyllis Kurlander Costanza from UBS Optimus Foundation, Sameh El-Saharty from the World Bank, and Magda Robalo with Women in Global Health. Again, welcome to our virtual panelists.
Great to be here.
So we all know that this global pandemic didn't discriminate by geographies. It certainly didn't discriminate by industry. It has impacted us all very personally, and it has been top of mind for us over the last 3 years. Here in San Antonio, if you think in terms of our largest industry, so biomed and healthcare, of course, our frontline workers and researchers have been impacted. Manufacturing is a large industry for us, and I think we're all still feeling the impact of global supply chain disruption. The tourism industry in San Antonio is significant. In fact, we welcome over 40 million visitors, including our keynote speaker, to San Antonio annually. And arguably the tourism industry and hospitality industry was the hardest hit in the pandemic around the world. Interestingly enough, cybersecurity has been a high growth industry for us here in the San Antonio region. And we believe that that growth opportunity is only going to be expedited now that we are all really leaning into this virtual means of engaging and operating through our personal lives and through our businesses. And so that will continue to be an opportunity for us. There are 2 statistics on the heels of the pandemic that I like to highlight and that I am proud of. One is that San Antonio and the regional economy ranked 4th for job resilience in the pandemic, and so that's jobs retained during the pandemic. We have also now fully recovered and added, we're net positive on jobs that were lost. We have now recovered those jobs in the San Antonio economy. But more importantly, I would like to highlight that in 2020, which was the height of the pandemic, San Antonio added 3%. So we grew our percentage of 2- and 4-year degrees, which is how we define educational attainment. We grew that percentage by 3%. Which was higher than communities like Austin, Nashville, and Denver, and it was significantly higher than the national average that remained flat. And I think that is something to be proud of. However, I would tell you that beyond the industries and beyond the data points, the global pandemic shined a light on some of the issues that existed in our community and several other communities around the world. And they were really exacerbated by the pandemic, not created by the pandemic. Those issues were poverty, income inequality, racial injustice, and a lack of educational attainment. These are hard issues. But the pandemic really shined the light on them, and I am proud from a personal perspective about how our community has rallied around these challenges. Our elected officials during the global pandemic were hosting daily information sessions that we all tuned into. In fact, they tried to share with us as much information as they could. Even in the early days, I don't really think they had much, but they were there and they were being transparent, and Mayor Nierenberg and Judge Nelson Wolff were with us daily in our homes giving us updates. Our largest employers like HEB, they've been recognized around the country for their responsiveness to their customers and to the community. Our large hospital systems, University Health, UT Health, they vaccinated thousands of San Antonians, and I have to recognize Texas BioMed for working with Pfizer to develop a COVID vaccine. These are game-changing things that we did together as a community, public-private partners working together. The biggest success, I believe, though, during the pandemic was when San Antonians unanimously voted to approve SA Ready to Work, which is a program that will reallocate $30 million of existing tax dollars annually to upskilling San Antonians, to target folks that have been impacted, perhaps dislocated hospitality workers and the like, and train them up, provide them the appropriate training to fill in-demand occupations within biomed and healthcare, within manufacturing and within cybersecurity. That is game-changing, and that will position our economy for growth well into the future. So these are just a couple of things that I am proud of how our community responded, and that really highlight that intersection that we'll talk about today on this panel, that intersection of public health and the economy. So now let's dive in. And Chris, can I start with you?
Sure.
All right, you've had your coffee, you brought it up on stage. Are we ready to rock and roll?
Well, I just started drinking it, so it hadn't really set in
Okay,
yet.
well, take another sip. I'm going to ask you a really, really thoughtful question here.
Okay, let's go for it. All right.
So Chris, how have you seen the COVID-19 pandemic shift the public's perception or even awareness of health issues and overall medical research and discovery?
Wow, that's a phenomenal question. And none of this is scripted, by the way, so just to let you know. All right, so I think that when I think about where we are as a society globally, first of all, let me give a shout out to Dr. Monroe. I loved your opening remarks. And it just reiterates the significance and the critical role that many of our public health agencies play in this sort of global healthcare system. And I think that one of the remarkable things that I've loved about the pandemic, for all the things that are wrong about the pandemic, let me say, is that we've seen global collaboration across different industries, whether it be public-private, whether it be providers and pharma, whether it be patients, payers, everyone, sort of a roll up your sleeves and everyone has gotten involved. And another thing that we've seen is sort of the pre-competitive collaborations that we've seen within industries that I think have been significant. And what it shows to me is the power of what can happen when we all have a shared vision, we have a shared cause, and we're all working together in unison in order to make that happen. There are several things, and I loved your opening remarks about raising issues around equity and all the issues that have been exacerbated as part of the problem. I think for us, one of the things that we should not lose sight of is the capability that we developed, the paradigm that we've created, where we can now develop drugs and vaccines at record paces. You know, this issue of clinical trials is where sort of the perspective I want to bring into this conversation, because there's multiple issues and challenges that we've had with the development of medicines for a very long time. If you think about the traditional clinical trial process, it really hasn't evolved much over the last 50 years. But now, with many of the digital and data technologies that we have available to us now, you saw it in real time, how it can actually accelerate the development of medicines and actually the distribution of those. Now, what it also did was sort of place a spotlight on issues such as equity, diversity in clinical trials, the equitable access to trials as well as the medicines once they're actually being manufactured and they hit the, hit the pharmacies. And I think that where we are is, while I feel like we made significant progress, we still recognize there's a long ways to go. Mm-hmm. And I think that, it's pretty interesting that as part of this, during the course of this pandemic, my dear mother, who knows nothing about the drug development process, knows nothing about what I do actually, probably knows more about the different phases of the clinical trial process more so than, than she ever did. And I think that that's, it's great in the sense where you now have this sort of public awareness, this public sentiment about what's most important, and now you're empowered patients to sort of ask the right questions. And so I think that when I think about some of the key takeaways from this or observations from the pandemic and what we've learned, one thing that we learned, and just acknowledge Dr. Monroe, the significant role that public policy, public health agencies play in these sorts of situations such as pandemics. I think we recognize the significance of the issue of trust, whether it be public trust towards pharma, I will say that, public trust towards politicians in the public sector and how critical that is. We recognize the significance of sort of public education and awareness and bringing people along and meeting them where they are, right? I think for a long time we were talking at people and not with them. And sort of seeing the backlash that we received during this process has been a bit enlightening and eye-opening. I also think now we recognize that, the 362 days that it took to sort of to discover and develop and obviously get the emergency approval of the vaccine, those things are possible, right? And so I hope that we carry with us many of the lessons that we learned, many of the sort of accelerated processes that we developed into the new world, and it's not just, it was just the pandemic, a moonshot, and then we're not going to sort of implement those or institutionalize those changes.
Amen. Amen. I think Dr. Monroe, and in fact, Larry mentioned it as well, right? Not just prioritizing this type of work and research during an emergency. This is something that needs to be prioritized at all times so that we can pivot, right? So that we are prepared to pivot when needed. Thank you for that. Phyllis, if you don't mind, I'd like to talk a little bit more about the social impacts, right? So not just the direct health impacts, but the social impacts and prioritizing those. Can you talk to us a little bit about your perspective in that regard?
Sure, thank you very much. It goes without saying, we all know it, that COVID really underscored inequality in healthcare. It underscored inequality across myriad sectors, but particularly in the healthcare system, where we see in the United States, we're on our fourth shot, and people in developing countries haven't even gotten one jab. So this is one of the critical issues. And it's not the first time we've seen this. There's disparities in healthcare for decades and hundreds of years. And the issue is, how can we ensure that healthcare gets to those who need it most? If we look at our spending, in the US alone, we spend almost $1 trillion from local government, state government, federal government on human service programs and healthcare programs. Yet we have knowledge of impact of less than 1% of that. And we know from JAMA, there was an article that also underscored the waste in healthcare, stating that 30% of healthcare spend in the US is wasted. And this is a huge problem. It's not just about getting more money to healthcare, but it's about getting better money to healthcare. So how do we do that? Well, I come from the finance sector, so I'm going to be looking at this from a financial lens. Now, if you think about government spend, I've already underscored that it's not evidence-based, although it ought to be. Philanthropy is similar. Spending in philanthropy can be arbitrary. There's no good way to match sellers and buyers of the services. How do I know if I'm giving philanthropically that I'm investing in the best healthcare organization? I have no idea. There's no transparency. I don't know what it ought to cost. If I want to say, for instance, make sure that there is breast care screening for all of communities of color in New York, I have no idea what that ought to cost. What should it cost to get somebody from their home? First of all, encourage them to go, and then get them there. And then the cost of actually delivering the service. There's absolutely no transparency on that. So probably about a decade ago, we started experimenting with something called social impact bonds. And the way they work is quite simple and elegant, yet complex. Simple and complex at the same time. So so we know the government doesn't pay for prevention. Government budgets typically go for healthcare crises. So if, though, a group of investors want to fund an organization to prevent healthcare issues, so for preventive care, then the investors could invest in a nonprofit, give them the money they need. I'll stick with the same screening example to ensure that people in communities of color all get screened for breast cancer. Then an outcome funder, typically the government in this case, they will pay if and only if those people actually get screened. So we know the money is working. They have to pay a little bit of a return because the investors are taking on the risk. But we know it's working because it's verified, and government only pays if it's working. Well, that is, it's a really cool solution to a huge problem, not just in healthcare, but in education, in incarceration, in myriad problems. But they're complicated. You know, to do a social impact bonds, they're done on a deal-to-deal basis. They're expensive. They take a long time. You have to have lawyers in there, consultants, people with fancy degrees. And I can assure you, people with fancy degrees don't come cheap. So these are really expensive to build. So what is the next step? I never believed that social impact bonds were the thing. These aren't going to solve the need for better spending in healthcare, but it is the thing to the thing. So what is that thing that we're all looking for? For those of you who aren't familiar with the terminology ESG, it stands for Environmental, Social, and Governance. And that's an acronym that's used to categorize companies that are doing well. So people want to invest in, quote, ESG because they want to invest in companies that are sustainable, companies that have a good environmental record, a good social record, and a good governance record. We figured out the E and the G. So we know, it's very easy to know what a corporation's carbon footprint is. They've managed to do that. There's a whole market to trade carbon credits. That it's not perfect, but we're getting there. The G, we also know, we can look at policies and procedures. We can see whether or not the board of directors is diverse. We can see whether or not the executive board is diverse. So that's easy, and we can look at their policies related to how they contract with suppliers and things. That's easy. What remains quite nebulous is the S, the social piece of it. So how do we get our head around that? Well, right now, we don't know how to rate companies based on the S. Yet we know right now there's $40 trillion of assets under management in ESG. More companies want to have a good ESG record, and more people want to invest in companies that have a good ESG record. So there's actually more demand than there is supply. And we haven't figured out that S yet. So to figure out the S, one idea for that is to take the concept of a social impact bond and the carbon credit and create a market to buy social outcomes. Can we come up with benchmarks so that we understand the cost of delivering certain healthcare procedures, understanding some are more complex than others, but getting an average benchmark cost so that companies can go to a market, companies, governments, philanthropies, we can go to a market and buy outcomes like healthcare screening for particular communities. One example also I use, not necessarily in the healthcare field, although related, is homelessness. So for those of you who've been to San Francisco lately, you know they have a critical homeless problem. Companies don't want to locate there anymore because employees don't want to live there. So if I'm a company who wants to move a group of employees to San Francisco, why can't I go onto a market and buy thousands of homeless credits, which would get people off the streets and into homes with the psychosocial support and the healthcare support they need? So when I think about where we need to get to in the healthcare market, in the financing of healthcare market, or in all social and healthcare services, it is to create a market to buy very specific outcomes. And it's going to require it's a whole new category for us. It's going to require us to do a lot of data crunching, understand of the 1.7 million nonprofits in the United States, which ones are delivering the best outcomes for the best price, and the small ones that are raising very little money, which unfortunately most of them are, will never be able to scale these outcomes. And we need to see more mergers and acquisitions in the nonprofit sector. So my vision for this space is a world where we've got a market where people know it's transparent, we know what it costs to buy a specific healthcare outcome, we can go to the market and purchase it, and we know that it will be verified. Thank you.
Wow. Wow is my only response to that. If you see me up here taking copious notes, it has nothing to do with moderating this panel. It is truly just me consuming this incredible knowledge from my fellow panelists. Thank you for that. I feel here within that conversation that there's some sort of city coin blockchain element to making that a reality.
Of course there is.
This is fascinating. Well, thank you so much. I am going to pivot here. And Sameh, I'm going to ask you, in your work really around the world, you're engaging with public sector, private sector. How do you feel like the pandemic has encouraged us to better cooperate cross-nationally?
Okay, well, Jenna, thank you very much. And to answer this question, it's important to note that the world has been faced with the largest economic crisis not observed in a century. So the globe was faced with double shock, a health and economic shock, and that we had to deal with it cross-nationally and come together, as Dr. Larry Schlesinger mentioned at the beginning, that we had to come together in order to face this crisis. Let me speak a little bit about the economic impact of the pandemic, because this is where it all started. In 2020, the world economy shrank by about 3%, and economic activity contracted in 90% of countries. This is unprecedented. And after rebounding to an estimated 5.5% in 2021, global growth is expected actually to decelerate to 3.6% in 2022, reflecting continued pandemic flare-ups and the recent conflict, of course, in Ukraine. The unprecedented economic recession induced by the pandemic actually led to the largest single-year surge in global debt in decades. In 2020, for example, the average total debt burden of developing countries increased by roughly 9% of GDP, compared with an average annual increase of only 1.9%. I can go on and on in terms of the economic impact as well as the health impact. For example, on the health impact, prior to COVID, progress on health and health-related SDGs were already lagging. For example, financial hardship was trending in the wrong direction, with almost 1 billion people facing catastrophic health payments. Only in 2021, 1/3 of the households globally reported affordability as the main reason for not getting health care when needed. And the recovery is uneven, as some countries are doing better than others. For example, COVID-19 vaccine doses administered per 100 people is only 24 in developing countries versus 148 in developed countries. This is more than six-fold difference. No one country could face this alone. And that's why, in order to work together, we need to work on the accelerating effect of the pandemic, which is, I consider, sort of the silver lining in this pandemic. And by that I mean that many reforms and innovations that were adopted that would have otherwise taken longer to be established, such as expanding cash transfer programs and social safety nets, expanding e-government services, and the use of technology in distance learning and education. But more importantly, Jenna, and above all, is what the health sector has done in terms of global collaboration. And I think already Chris alluded to that point in terms of global collaboration on genome sequencing, drug and vaccine development, and rapid test development, consolidation of supply chain logistics, the innovations in the use of technology for teleconsultation in primary health care, using drones for the delivery of medicines for chronic disease patients, telemedicine for remote diagnostics, and using geospatial mapping, artificial intelligence, and machine learning to track the pandemic. And this is just to name a few of the innovations that the world has come together to try to face the pandemic. In fact, what the health frontline workers, healthcare providers, health technicians, managers, scientists, innovators have done in the last 2 years is simply historic in terms of collaboration. To your point regarding the collaboration, Jenna, I don't think that we can do this alone. And this where the role of the international finance institutions, the private sector, government, the philanthropy have to come together. And I'll just share with you examples of what the World Bank has done as one of the international finance institution in this regard. The World Bank actually delivered 204 billion US dollars in financial support to public and private sector clients to help developing countries face the double health and economic shock in order to save lives and livelihoods. The support included 135 billion US dollars to governments, $60 billion to the private sector, and $9 billion to support investment guarantees. More specifically, just for supporting the vaccine rollout, the World Bank Group approved projects in more than 100 countries, amounting to about 20 billion US dollars since the beginning of the pandemic. And by the way, we did not do this alone. We had to mobilize the private sector, other donors, other partners, governments, talking to my ministers of finance in the client countries so that we can come together. And the challenge was not just to procure and secure vaccines for developing countries, but also to help strengthening the logistics, storage, distribution, and service delivery systems within these countries to serve adult population at unprecedented scale and speed. Let's remember that the vaccination system and programs in these countries are mainly catering for young people, for young children. Now we're talking about the entire adult population, actually the entire population. And that required the collaboration across nations, across institutions, governments, private sector, and philanthropy, as I mentioned. And I think we have done a great job in this regard, and we need to capitalize on that as we go forward.
Excellent. I couldn't agree more. Thank you so much for that. And I'm assuming if you're like me, these comments are stimulating some questions, some thoughts, and some ideas. I would encourage folks that are joining us virtually to insert your questions into the chat. I know that my colleague Tracy is managing those for us, and then those for you in the room, we'll actually open it up for Q&A after a couple more questions that I have. Magda, I'd like to ask you a question. Specifically, you know, when work and home collided during the pandemic, there were some unintended impacts that disproportionately impacted specifically women of color. I know I have a young child, and I thought so much during the pandemic about how fortunate I was to have the means to provide support to her while I was managing my operation. But give us your thoughts on that impact and how they have varied across populations.
Thank you very much, Jenna, for that question. Yes, we talk about the COVID pandemic exacerbating inequalities. And if there is one area where inequalities were exacerbated, is particularly in the field of gender. health was at the center stage, as well as the economy globally, and this has exposed the deep inequalities between and within countries, but also inequalities between women and men. As you may know, women have made an exceptional contribution to health systems, to economies and societies, from community to local, regional, and to global levels since the start of the COVID pandemic and even before. 70% of the global health workforce and 90% of health workers in patient-facing roles are women, and they have shouldered the burden of health systems delivery for more than 2 years of exceptional pressure caused by this pandemic. And we know the impact of the pandemic will continue to be felt for many years to come. But even before the pandemic, gender inequity was hardwired into the global health workforce, with women clustered into lower status and lower jobs, marginalized in leadership, and frequently subject to violence and harassment. To specifically come to your question, how does this impact women in the workplace and also at home? As we all remember, schools were closed and children had to stay at home, and their schooling, homeschooling, was being taken care of by their mothers, which at the same time had to work, particularly those working in the health sector. The occupational segregation of women and men into different parts of the health workforce contributes to a gender pay gap, which I will talk about a little bit later on. But just to bring into this conversation another recent impact of the disruption caused by the COVID-19, which has to do with increase in malaria deaths and malaria cases, as well as disease that are preventable by vaccination. As you know, malaria and disease prevented by immunization affects children in majority, and these children are taken care of by their mothers or the women in the health sector. So this is an additional burden that is coming to affect women in the health sector, but also at home. Therefore, when we talk about building back better, stronger, and smarter, for us, the most important issue that we need to consider is building back equal with diversity and inclusivity to make sure we address the inequalities between all genders, particularly in this case of the health workforce, between men and women.
Building back equal. That is a tagline that I will use going forward. I appreciate that level of inspiration. Heather, let me ask you, and then we'll open it up to the audience for some Q&A, but let me ask you, specifically your organization, the mission is to grow the bioscience economy in San Antonio. How do you think San Antonio played on the global stage during the pandemic, and what do you think's next for this industry in our region?
Yeah, I'm happy to answer that. COVID was a great demonstration and strengthening of the collaborative spirit in San Antonio and the community spirit. And that was evidenced by individual organizations stepping up, like Texas BioMed, to come up with the primate models, but also other organizations that weren't directly involved in the healthcare and infectious disease realm stepped it up also. And a lot of that had to do with those collaborative relationships that were already in place. For example, UTSA worked with hospitals and donated their PPE to hospitals when they couldn't get it. They also converted some of their chemistry labs to create hand sanitizer and passed that out. Southwest Research Institute developed protocols to test mass sterilization effectiveness or sanitation effectiveness as masks were having to be reused because they weren't available. So it's those kind of things that were very indicative of the collaborative environment here. And this pandemic situation also underscored BioMedSA's role and ability to convene the right people together to tackle these significant community health issues, as well as grow the economy at the same time. Our mission at BioMedSA is to accelerate the growth of the healthcare and bioscience sector, create regional economic benefit, and contribute to the health of San Antonio and beyond by establishing San Antonio as a leader in healthcare and bioscience. And we really take that to heart in 3 different ways. We support the industry that's already here, we create actions for growth, and we promote the region not only for companies to move here, but also talent to move here to support the growth that we're experiencing. Now, San Antonio is the 7th largest city in America, and the healthcare and bioscience sector is the largest economic contributor in this region. And this economic sector is made up by, or comprised of the largest military health complex in the country. The 7th and 8th largest hospital systems are here. It's supported from an education standpoint, having 3 medical schools, 2 dental schools, pharmacy, nursing schools, engineering, science, all of those educational aspects. And then when you look at the research side, which is extremely helpful, there are 3 independent research organizations, Texas Biomed being one of them. There are 12 DoD labs and 6 academic institutions all doing research in the medical space. And so we have the potential and the foundation to pull organizations together to accomplish great things. We initially focused on the support of individual companies. When the pandemic started, we, like a lot of people, put a lot of effort into the communication side of things, which is still important beyond COVID, because people do have alternate work schedules and they need information to move forward when they need it, which may not be 8 to 5 in the traditional sense. Looking at industry information as well as information that can help people move forward and get the information that they need. We also hold a lot of one-on-one support meetings, about 30 to 40 a year, to connect with companies and find out what their pain points are, connect them with resources that can address the issues that they're facing. But we also ask general questions and trend those and communicate them across the city, whether it's to economic development organizations like Greater SATX in the city, or the individual companies. And these are things like workforce needs and FDA trends and what companies are seeing as they work with the FDA. We also have transitioned into establishing targeted networking meetings. And these came up early in COVID as being essential to communicate from the hospitals to industry what they needed to help them, but also people who should really know each other to be prepared for the next pandemic or the next major issue. This could be people working in the same disease area, whether that's infectious disease or cancer or neurological disorders, or people on the business side that should know each other, independent consultants in life science or supporting organizations, so that those personal relationships are established and ready for the next crisis or issue. But beyond supporting companies individually, we also are enabling people to collaborate together using their experience to accomplish a significant community-wide initiative. And people want to help out, particularly in a time of crisis. People are looking for that way to contribute. And in 2020, in June of 2020, we established a clinical trial task force. And this group was comprised of people representing all aspects of the clinical trial ecosystem, whether that's sponsors, clinical research organizations, or CROs, sites, and pulled them together and said, okay, San Antonio already has a significant clinical trial ecosystem. We have 1,400 at that time active clinical trials going on. But how can we improve that and optimize that ecosystem to be better? We looked at what we have here and the assets and the way people do or do not work together, and we benchmarked off of other regions across the country that had seen growth. And this group came up with an action plan to optimize this industry. And a key component, or the main component of this action plan, is to put together a clinical trial hub to connect sponsors to sites, to be aware of studies that are going on, supporting organizations that can help sites to put those connections. But probably the most important part of this is to look at the enrollment piece, which is the most important thing for any clinical trial, is getting that enrollment, because San Antonio has the desired population for clinical studies. We are an ethnically diverse city with the largest Hispanic population in the US. We also, unfortunately, have a lot of comorbidities that are important for clinical trials, such as obesity, diabetes, cardiovascular issues. And those are all important foundations of the clinical trial system only if those people are engaged in it. And for someone to get involved in a study now, they pretty much have to know somebody who can go to the federal database and look it up to find a study, or their doctor has to spend that time and effort, if they know how to find it, to get them into a study, or they happen to go to a doctor that's in one. And that's really not an efficient way to enroll people in studies or provide the benefits to the community on cutting edge new technologies in healthcare. There's also another piece of it, is that not everybody is involved in the medical care system at all. These are people who are in underserved areas that don't have medical insurance, they don't have neighborhood doctors, they're not going to the doctor. And part of this effort as we put this hub together is communicating out to people the benefits of clinical trials and why they should participate. And then this database, or this hub, will enable them to find the trials and to participate. And there's a significant health equity component of this, because it has the potential to introduce people into the medical care system, as well as the screening that's provided as someone is applying to participate in a trial could identify an underlying health issue they didn't know about, but if it isn't resolved, we'll put them in the ER a year or two, whatever later, and they had no idea. And if we can interject earlier into that person's health care and get them into the system of care, that would be very helpful. Now, also, once people participate in the study and the study is over, that health care they were receiving during the study is now completed. And we are going to provide to the sites conducting studies in San Antonio information that they can give out to people who applied and maybe aren't in the trial, or people who finished the trial, of where they can go to get free medical care, subsidized insurance, that kind of thing. So they're being brought into managing their own medical care with the assistance of medical providers. So that's a pretty exciting one that the community is coming together toward. This year, we also initiated a workforce initiative in the area of life science career packets that we are putting together. So as Jenna mentioned, and the city has the SA Ready to Work initiative that is putting forth a lot of dollars and a lot of effort to train people. We want to make sure that they have the information on life science careers. We're bringing together industry to select those careers that are important for them to fill, the jobs are available, and then use that information to develop these packets we can put in people's hands across the city. This is information that describes jobs, the salaries, the career ladders, which are very important, what training's required, where to get it locally, how to apply, and what resources are available, such as childcare and transportation and free tuition. And we view this as, of course, it's an economic development play to help companies that need to hire workers, but it's more than that. It's also an opportunity to break the poverty cycle. People tend to pick careers or jobs based on friends and family, neighbors who give them advice on what to do. Well, there are many neighborhoods where there's no one who's got a professional job, particularly a life science job, so they're not hearing those stories of what those jobs could be. And we want to interrupt that and give them information at the high school level and adult level so they can make informed choices about their careers and their livelihood. Another initiative that we are about to start in a few months is bringing together San Antonio's strong cybersecurity community, which is the largest employer of cybersecurity professionals outside of the DC area, and San Antonio's medical device community, and bring those groups together so they can understand the other industry and expand their businesses into those areas, and then also work together to establish what the best guidelines should be for medical devices as they're planning for cybersecurity, and then take that up to the FDA and let them know, hey, this is what experts are recommending, because the FDA guidance is fairly old and not necessarily meeting the needs. It's not up to date. So that's an area that has a national or perhaps worldwide implication, but it's bringing people together so they establish those relationships. So after that work is done and there's another crisis that comes later, people know who to call and they can facilitate action faster and on their own. Because when people collaborate, the impact is larger And it's not only from an economic development standpoint, but also particularly in this industry, it's a community standpoint that is really good to see that impact.
Excellent work ongoing at the local level. I appreciate that, Heather. We now have time for a few questions from the panel, from the audience here in person, and our Texas Biomed team is going to circulate a microphone. I just ask that you raise your hand if you've got a question and direct it to a specific panelist. Any questions? Please.
Thank you. Outstanding panel. Thank you all. I really was taking also copious notes, a lot of broad perspective. Many people have mentioned, including myself, that this was a global response to the pandemic. And so global, in my mind, crosses continents, etc. Sameh had mentioned the importance of private-public partnerships, philanthropy. This is all sounds really good to me. But one of the key words for globalization of response to me is trust, and trust takes time. In the case of the pandemic, when we reacted, people came together. Actually, as a scientist, that's the easiest part since we work internationally all the time across borders. But I wanted to know whether any of you could provide us a clear-cut example of a new global partnership that has emerged, developing a trusting relationship as a result of the pandemic. Give me some hope that the infrastructure worldwide is beginning to change so that the concept of various industries coming together actually will be sustainable once this pandemic goes on to the third page of the newspaper. So I'd like some examples of what's been developed. Certainly we have technology. This conference is showing you that. I am so excited to have speakers from around the world. We can do this now. That's one important, I think, way of building trust. But that's my question. Some examples of building trust that did not occur before.
Excellent question. Thank you. Phyllis?
Sure, I can give multiple examples. I think that some of these initiatives were probably in their formative stages prior to the pandemic, but I found that they were probably a bit more solidified or accelerated during the pandemic. And one of those would be the IMI initiative that I know is happening in the EU, where they were pretty focused on trying to utilize real-world data or data from these digital and data technologies that are out there in order to sort of create patient registries or disease registries that will give us a better understanding of these diseases and how they progress in various populations. I think what the pandemic did was sort of incentivize, because that is a public-private partnership, right? There are a number of pharma companies, several of us that are involved in that. There's providers, there's patient groups, there's obviously the EU public agencies that are involved. And what it did was, I think earlier on there was sort of I don't want to say we were a hammer searching for a nail, but I think in many respects we were trying to find a clear objective that we all shared and that we thought would be meaningful. And I think that, it's kind of going back to the remarks I made. It's really around if we can sort of define a shared objective, I think that you find, to your point, that collaboration seems a bit more seamless. So the problem is that the incentive structure is not there, right? And your other point around trust not being there. Another thing that we've done too is sort of collaboration directly with the Chinese FDA, as far as they have a great or sort of incentive or even interest in understanding and utilizing real-world data beyond clinical trials, right? The data beyond clinical trials, to better understand how certain therapies and interventions are affecting the various populations. And the one thing that I love about where we are right now is there is a considerable amount of interest in understanding how interventions work in various populations versus the sort of generalizability of one therapy or one intervention for all people. And I think that we've known for a long time that sorry about that.
Is that your mother?
No, this is my mother. This is my spam call due to AT&T. Shout out to AT&T for all these spam calls I'm getting lately. No, but I think that, so we've now engaged on an international level with local universities, local governments, even pre-competitively with other pharma companies, to try to build infrastructure that can now sustain. Now, if I listen to all the comments that I heard, I think one of the sort of common threads that I take through it is investment in infrastructure that will now sort of position us better to be a bit more sort of proactive and more in a rapid response fashion to sort of these public health emergencies, more so than we did this time. And honestly, for all the things that were wrong about it, the 6.2 million people that unfortunately lost their lives during the pandemic, I think we learned some hard lessons as a global society, and I hope that, again, we institutionalize many of those learnings in how we move forward.
Yeah, targeted investment, definitely. I saw a couple of our virtual
Jenna?
panelists. Yes, please, Sam.
Yes. Okay, I think this is an excellent question. And I think the question has two parts. One is example of collaboration as well as, trust. One example that comes to my mind is the COVID-19 vaccines global access, which is known as COVAX. This is an alliance of Gavi, the Coalition for Epidemic Preparedness Innovations, UNICEF, WHO, and the World Bank. This group of institutions and organizations came together to ensure equitable access to COVID-19 vaccines, particularly for low and middle-income countries. Again, that was an unprecedented effort for different organizations to come together to secure vaccines for low and middle-income countries. I think by April, there was about 1.4 billion doses that were distributed to developing countries. On the trust question, maybe I mentioned in my remarks the challenge that we were facing about building the logistics system. It wasn't just about procuring and getting vaccines to the countries, but also ensuring equitable distribution. And one challenge that we were facing, and I think it goes back to the issue of exacerbating or revealing effect, which was the mistrust between governments and people, right? In certain countries, it was there. And that's why it was a double effort, not only to getting the vaccines to the countries and supporting and strengthening the logistics system of storage and distribution, but also campaigning to build more trust between people and their governments, about the safety and the efficacy of the vaccine. So this is just one example of this collaboration. Over to you.
Thank you. Magda, you had a comment?
Yes, I do. I also think that's a fantastic question. On one side, the issue of trust. And the example of vaccines is a beautiful example to talk about trust between the global north and the global south. We have a huge disparity between coverage with vaccinated people in the global north and the global south. I think we heard from the Global Fund that there is a fourfold difference between people who are actually fully vaccinated, even with 4 doses in the global north, and very few people vaccinated in the global south. This is a major break on trust between nations around the world that we need to work into mending and reconstructing, if you want. But there is also a breakthrough in terms of improving technology and knowledge sharing for the future. We are still struggling with issues around TRIPS, patents around vaccines and transfer of technology to Africa. But we have seen back in February, several countries, Senegal, South Africa, Egypt, launching production of vaccines in their own countries to prevent similar situations in the future. So I think there has been a massive progress in terms of adapting and expanding capacity for responding to similar pandemics in the future. out of lessons learned from the current pandemic. And let me just take this opportunity to say, unfortunately, we don't have, very few countries collect sex disaggregated data, and we don't have a full picture of how women are being vaccinated and even testing for COVID-19. We need to improve data generation, collection, and analysis, but we anticipate that women are being left behind in terms of access to vaccines due to gender norms that prevent them from accessing health services, etc. Thank you.
Thank you. On the theme of trusting government, we have a good question. Actually, it exemplifies the global reach of this symposium, a question out of South Africa that we received online. And the question is, what lessons can we learn from the impact of hard lockdowns and devastations in local economies, specifically in developing countries? Are there any collaborative decision-making frameworks that we saw work well? I will tell you, not a developing country, but here in San Antonio, within the state of Texas, it was very messy. The governor mobilized a strike force where he brought together medical professionals and top business leaders. Here locally, we developed a similar structure. In fact, I helped facilitate the business side of the equation. But even just the communication and information sharing from the state government to the local government was very, very chaotic, and it was very messy. But we made our way through, and those decisions were primarily made at the local level. But were there any successful models around the world, specifically in developing countries, that we could model after or learn from?
We were all learning through this pandemic. It was a novel virus, true, and as scientists, as public health workers, as policymakers, we were learning as we go. The lockdown was definitely devastating for many cities and citizens around the world, and that's what actually sort of propelled many innovations to try to deal with the impact or the negative impact of the lockdown. And here we're talking about probably two things. One is the lockdown that affected businesses, tourism, restaurants, and the loss of livelihoods, and also the health. People with chronic diseases could not access healthcare in a timely basis. And also, one important effect was the exacerbation of mental health issues during the lockdown. Now, what happened is that, as I mentioned, there were many innovations and platforms using technologies to try to bridge this gap and deal with the negative impact of lockdowns. I mentioned, for example, in some countries, drones were used to deliver medicines to where it is needed. Many platforms and applications were developed, right, to connect people with their families, and also, and this is sort of a good example of the proliferation of different platforms to enable businesses to continue. The Zoom, the WebEx, the Teams, all these platforms sort of reduce the impact of people feeling lonely and isolated. So yes, there are many lessons that we can learn from going forward. And as I mentioned, it's important to capitalize on these innovations and not let them go. Thank you.
If I may just comment on the impact of lockdown, there is no doubt that in some places digital technology has been really very helpful to reach people with health services, but also with entertainment, etc. But we have seen also an increase in gender-based violence to the extent that it's called the silent pandemic, or the ignored pandemic, which was happening in homes while people were locked down. So women really had to endure gender-based violence, and unintended pregnancies actually did increase as a result of lockdown. So these are just some of the negative impacts that we should also not ignore and make sure that we address them. And as we work on the pandemic accord that WHO and stakeholders are working on, we need to make sure that all these lessons learned from the COVID pandemic are prevented in the future.
Mm-hmm. And Magda, we shouldn't forget also about the mental health crisis that this has sparked as well.
Indeed.
Absolutely.
Indeed, I think time for one more question here. Thank you.
I'm going to keep this short. Thank you very much for the organizers. My name is Dr. Achebe. I am the CEO of AID PBC. Our focus is Africa. My job at this conference is to bring Africa to bear to the consciousness of all the panelists. So thank you, Mr. Boone, for talking about investment. I feel the big elephant in the room is we're not Europeans and Americans having a conversation. This is global. Mm-hmm. We do not have systems that are comparable in Africa to Europe or America. There needs to be at the center a focus on developing infrastructure in healthcare on the continent. If we do not do that, we are setting ourselves up for a repeat of Omicron and so many others. We've seen what has happened with Ebola. I've been traveling the world screaming at the top of my lungs, we've got to make Africa center. We've got to find infrastructure investments to bring up the facilities and the standards on that continent to be at the level where the developed world is. And that's just my comment. Thank you.
Thank you.
I agree.
An absolutely fantastic comment, and that's what Africa CDC is doing, and that's why we are calling for the new public health order. Build the infrastructure in Africa, build the capacity of African health workers so that we can rely on ourselves and build our own resilience, and we don't depend on externalities to cope with pandemics such as the COVID-19.
That was an excellent comment to end the panel on. I would like to thank you all for being here, your interest in the symposium, and a special thanks to our panelists for your insights and participation today as well. Thank you.